In every Australian state, there are currently battles underway to stop the construction of mobile phone towers near schools. Just this morning, a meeting was held in the Sydney suburb of Double Bay to plan a strategy against a tower that Optus wants to erect about 100 metres from a primary school. Two bills before federal parliament aim to give communities more say about where the towers can be installed. Communities are worried about electromagnetic radiation, even though the science surrounding the long-term risks from exposure is hotly contested. Martin Cudahy reports.
So many of us use them every day. Smartphones and tablet computers keep people connected to each other and to the endless stream of news, entertainment and opinion. After Singapore, Australia has more smartphones per capita than anywhere else in the world.
In fact, in Australia, we see mobile data traffic doubling every 9 to 12 months.
Growing demand for network capacity means there's a swag of infrastructure needed to keep people on the phone and online. Towers are the spine of this interconnected web. In June, the World Health Organization announced electromagnetic fields could possibly cause cancer. But conversely, it also states there's no convincing scientific evidence that weak signals from base stations can cause adverse health effects.
I really don't think that there are any risks. Science can never be 100% sure, of course, but we don't have any research pointing to it being a problem.
Nevertheless, across Australia, dozens of communities have been involved in campaigns to either move mobile phone towers or scrap them altogether. Leading one such campaign in Tasmania is ANTHEA HOPKINS.
I think the fact that this is sitting in a very high-density residential area as well, a lot of people with young children that will have 24-hour exposure, that there is just a lot of feeling in the community that there would be a better place for a tower.
Initially, two telcos wanted to put a tower on top of a supermarket in the Hobart suburb of Sandy Bay. Telstra pulled out after the community expressed its concern, but Optus signs are still on the proposed site, although the telco says the project is on hold and alternatives are being looked at.
You mentioned aesthetics was one of the reasons why locals were objecting to the tower. Is this simply a case of not in my backyard?
No, I don't think it is a case of not in my backyard at all.
ANTHEA HOPKINS uses a smartphone herself and says she couldn't do without it, but that's not the issue.
The issue here is not around the towers and the mobile phones in and of themselves. It is that there is actually proper community consultation.
The legislation allows efficient and effective deployment of infrastructure. It's got the balance right.
Under the Telecommunications Act, a telco has the power to install a tower on private land if it's classified as a low-impact facility. Telcos do this by issuing a Land Activity Access Notice and then following an industry code of practice.
This code, by our estimation, results in around 5 times more consultation than would normally happen through a development application in a council. It's a very important code. It's just been revised, and part of the revision is improving community consultation.
There is still a lot of anger in this community over the way that Telstra, the telco at the time, conducted themselves.
In the inner Brisbane suburb of Barden, Sandra BOLAND helped stop the installation of a phone tower about 100 metres from a local primary school. The community took Telstra to court.
We know that the science community is very much divided, and there are a lot of unanswered questions about the long-term health effects of this kind of EME.
Both Optus and Telstra were happy to let the industry representative do the talking for them.
Sometimes proposals are withdrawn based on community concerns. So there's a high level of dialogue that goes on here.
Most community concerns centre around long-term health effects because towers constantly emit a low level of electromagnetic radiation. The Australian Radiation Protection and Nuclear Safety Agency, or RPANZA, is the government body that sets the national standard. One critic questioning the health effects of this radiation is Don Maish. He recently completed a PhD that examined the radiation standards.
When you try to rely upon the standards to give an assurance of safety, it's not there.
He believes the radiation is affecting people at a cellular level and showed 730 readings of environmental radiation near a tower in suburban Hobart. Not all the radiation can be attributed to this tower, but when we went up a flight of stairs, the readings were as much as 6 times higher.
Yeah, 400, 591. The general thrust of the studies is showing that there is an effect. I mean, we recently had the International Agency for Research on Cancer come up and classify, radiofrequency as a possible human carcinogen.
In terms of health, we've got good reason to think there's not a problem.
Until July, Professor Rodney CROFT was the Executive Director of the Australian Centre for Radiofrequency Bioeffects Research. His research is similar to the work done by Don Maish, except for one crucial point.
There's any number of studies that do show, and I do have them available, that the chronic exposure, that long-term exposure, which is not in the standards, can have an adverse effect on health.
Where there has been a study suggesting that there may be a problem, it's then been followed up. People have tested it, tried to find the same results, and they consistently fail to do that.
The towers typically operate at levels thousands of times lower than the health standards set by the World Health Organization. But with communities still battling towers in every state, the issue is unlikely to disappear anytime soon.
Martin Cudahy reporting.